Hello, I'm Joanne Spoto-Decker, the Executive Director of Onondaga County Office for Aging. It is my distinct pleasure to welcome you to this virtual report to the community on our 2021 service plan. Each year, our office plans the programs and services that we will provide Onondaga County seniors and their caregivers in the following year. We hold in-person public hearings to receive input and feedback on what is going well and on what may need to be emphasized in the future. This year, due to the COVID-19 pandemic, we were unable to hold these critical in-person forums. In November 2020, we used an online survey process to ask Onondaga County seniors and senior service providers to provide input on the issues, programs, and services that are most important to seniors, their caregivers, and their families. Many thanks to Maxwell School of Citizenship and Public Affairs students, Ilana Sestero and Joanna Vines at Syracuse University for their assistance in compiling the important data that you're about to see. Our mission is to improve and enrich the quality of life for all older persons in Onondaga County, and working closely with seniors and senior care providers helps us do that. The Office for Aging provides a wide range of cost-effective community-based services for older adults to keep them in their homes and out of costly institutional care facilities for as long as it is safe and feasible to do so. We also provide programming and support to caregivers to assist them in meeting the daily challenges of caregiving. And we offer programs that provide a wide range of services that support healthy aging in a community setting. The survey process gave us valuable information. Let's start with the senior survey. 238 seniors participated. A look at the demographics of the participants reveals 20% were male and 80% were female. The majority, 75%, were between the ages of 60 and 79. 15% earned less than $15,000 per year. 59% of respondents are single, widowed, and 41% are married. 53% live alone, and 35% live with one other person. 78% are retired, and 21% still work with full or part-time jobs. The first senior survey question: what concerns you the most? Seniors were encouraged to select all that applies. Not surprising, 62% said the pandemic. 61% said health and fitness. 32% said healthcare costs, and 31% said home repairs. 30% were concerned about being alone and isolated. 29% with depression and anxiety. 28% living independently. 20% were concerned about grocery shopping. Senior concerns also included 19% with other money concerns, 18% heating costs, 16% transportation, and 14% housekeeping. 12% were concerned about meals and nutrition, 10% without managing medication, 9% housing, and 5% were concerned about the ability to bathe and dress oneself. A few seniors cited concerns with caregiving for others, home modifications, pet care and costs, finding a primary care physician, and finding reputable contractors and legal assistance. Survey question number 2. Are you familiar with the Office for Aging and their services? 68% said yes, and 32% said no. This is encouraging though. As recently as 2015, the number of seniors attending our public hearings were unfamiliar with all of our services, and that number was close to 75%. The Office for Aging offers these core services: information and assistance, nutrition services, ISO, our expanded in-home services for the elderly program, caregiver services, community service programs, HICAP, Health Insurance Information Counseling and Assistance Program, HEAP, the Home Energy Assistance Program, and health promotion. I'll speak about each of these a little more later in the presentation. Senior survey question number 3. What Office for Aging services have you used? Seniors were asked to select all that apply. 69% have used our senior nutrition services. Good nutrition is essential for healthy community living and independence. Our staff provides nutrition screening, individualized nutrition assessments, and diet counseling for those at risk of poor nutrition. We have dozens of senior dining sites throughout Onondaga County, providing nutritious meals for anyone 60 years of age and older, and their spouse of any age. During the pandemic, many of these sites have been providing nutritious, delicious pickup meals. During normal times, these sites give seniors the opportunity to socialize and attend programs and other health and wellness activities. And each summer, our office distributes the Farmers Market nutrition coupons. And lastly, home delivered meals are provided to those who are incapacitated and unable to shop, cook, or prepare their own meals daily. Meal delivery is also an important safety check for those seniors who live alone. Our nutrition service unit also manages our health promotion evidence-based programming in keeping with our goal of creating a healthy aging process. Courses offered currently via a Zoom format include chronic disease self-management program, Tai Chi for arthritis, and diabetes self-management program. 59% of senior respondents have used one or more of our community service programs. Our community service programs for seniors include many diverse resources for older adults, including programs and referrals for home repairs, housing counseling, legal services, shopper services, senior center activities, and social work services. We have transportation programs operating throughout Onondaga County, and we also assist with escort and medical transportation for those with no other assistance. Our Neighborhood Advisor program provides services to older adults to assist them in maintaining their independence. They also help people with applying for income stretching programs. HICAP, our Health Insurance Counseling Assistance Program, provides free and unbiased health insurance information and assistance. This is especially critical during the Medicare enrollment period, which opens October 15th and goes through December 7th. Staff and volunteer counselors assist with explaining medical bills, provide information on Medicare, supplemental health insurance, and prescription drug coverage. 50% of seniors said they have contacted us for information and assistance. Our number, 315-435-2362, is staffed from 8:30 to 4:30, Monday through Friday. Our staff will inform you on what is available and explain the eligibility requirements, and they will also give you information and contact numbers for other community resources when applicable. 26% of seniors have reached out to the Office for Aging for HEAP, the Home Energy Assistance Program. HEAP helps individuals meet energy expenses with a one-time payment to their utility company or their fuel vendor. Our office helps county residents age 60 plus access this benefit. We also assist seniors with linkages to other income stretching programs, including SNAP and the Medicare Savings Program. 18% of senior surveys have received assistance from our Caregiver Services Unit. We offer information and consultation to family caregivers. In our now virtual caregiver discussion group meetings, caregivers share their experiences and find peer support. The Institute for Caregivers offers public education by local experts on a wide variety of topics useful to family caregivers. Currently, these presentations are offered in a live Zoom platform and are available for future viewing on our website. 8% of seniors have used the Expanded In-Home Services for the Elderly program, or ISIP. ISIP helps older adults and their families delay or avoid placement in nursing facilities by combining case management and non-medical support services for frail seniors who are 60 years of age and older. ISIP works on a sliding scale fee. Case managers provide in-home care assessments where they review the personal care and light housekeeping needs for each and every ISIP client. We also provide short-term respite for family caregivers who need some time to themselves for whatever the reason. This respite can be in-home or through a social adult day setting. Aid service is provided through licensed agencies or through a community or consumer-directed model where the ISIP participant can hire and train their own aide. The wide range of services and providers for long-term care can be overwhelming. How do you find the service that's right for you? You can start by contacting our New York Connects program. New York Connects offers free and partial information and assistance to help Onondaga County residents and their families in determining what services or programs are available to them and which ones meet their needs most appropriately. We work with any age and any payer source. Have you experienced feeling down, depressed, or anxious in the past 6 months? That's our survey question number 4. 59% of our respondents said several days. 23% said not at all. 18% said every day, and 10% said more than 1/2 of the days. It is important to note that this period corresponds to a time of severe isolation due to the COVID-19 global pandemic. We have a vital program to assist in these unprecedented times. The Office for Aging offers the Senior Health and Resource Partnership Project, or the SHARP project, that serves seniors age 55 and older with addiction, depression, or other mental health issues. It provides care management, aging services, and mental health and substance use counseling. Senior survey question number 5. How has the COVID-19 pandemic changed your life? Seniors were asked to check all that applied. The number one reported impact was fear and worry at 73%. 67% said isolation, 59% health concerns, 33% shopping problems, 28% said financial impact, 14% had meal concerns, and 14% said transportation issues. During the past year, the Office for Aging responded to the COVID-19 pandemic in many ways. Just a few highlights include how our senior nutrition program managed the COVID-19 pandemic senior nutrition and healthcare worker hotline follow-up, responding to over 3,000 calls. Over 350,000 takeout and home-delivered meals were provided to seniors and healthcare workers. Office for Aging led this coordinated effort with multiple community providers as well as county interdepartmental staff. Office for Aging in New York Connects facilitated the delivery of masks and pallets of hand sanitizers offered from New York State Office for the Aging, resulting in the distribution of more than 35,000 masks and cases of hand sanitizers to assisted living facilities, nutrition providers, senior housing buildings, senior centers, community-based agencies, and transportation programs, totaling more than 65 programs and organizations. Senior survey question number 6. How do you find out what is going on in your community? Seniors were asked to select all that apply. It is not surprising that 79% of seniors selected television as their main news source. The internet was more surprising, with a high of 70% use. Email, 50%. Newspapers were at 48%, weren't as high as they once were. Neighbors and friends were 46%, lower during the pandemic. 44% said family, radio 29%, faith community 22%, and senior centers a low 21%, since they had been closed during the pandemic. We are so pleased to report that 39 of the 60 zip codes in Onondaga County were represented in our survey. 104 City of Syracuse seniors participated, as well as 130 suburban seniors. Next, we will discuss the senior provider survey results. 110 participated. We asked senior providers what they believe were the greatest concerns of our Onondaga County seniors. 92% said being alone or isolated. 68% said transportation, depression and anxiety, and 60% the pandemic. Providers ranked living independently, grocery shopping, meals and nutrition, healthcare costs as the next highest concern. Health and fitness, housing, home repairs, and managing medications were next. Providers finished their rankings with housekeepings, one's ability to bathe and dress themselves, money concerns, and heating costs. Providers also mentioned many other concerns as well. Senior provider survey question number 2. Are you familiar with the Office for Aging? 96% said yes, with only 4 saying no. Senior provider survey question number 3. What Office for Aging programs, services have you made referrals to? Providers were asked to select all that apply. Their answers showed that our office is an essential referral resource for them. Information and assistance, 82%. Home Energy Assistance Program, or HEAP, 67%. Caregiver services, 67%. ISO, Expanded In-Home Services for the Elderly program, at 63%. Home delivered meals, 62%. Neighborhood advisors, 61%. Senior centers, 55%. HICAP, Health Insurance Information Counseling Assistance Program, was at 50%. Our popular farmers market nutrition coupons, 48%. 41% said respite. Nutrition, education, and counseling, 38%. And senior dining sites, 37%. Senior provider survey question number 4. How has the COVID-19 pandemic changed the lives of the older adults you work with. Providers were asked to select all that applied. 97% said isolation. 86% said fear and worry. 72% healthcare concerns. 61% said transportation issues. 55% shopping problems. 42% meal concerns. And 32% financial impact. Senior provider question number 5. Have the seniors you work with voiced that they have experienced feeling down, depressed, or anxious in the past 6 months? 49% said several days. 31% said more than half of the days. 15% said every day. And 5% said not at all. Senior provider question number 6. What is the best way for the Office for Aging to communicate with seniors? Again, providers were asked to select all that applied. 81% said television. 54% said senior centers. 51% said family. 48% said neighbors and friends. 41% said newspapers. 41% faith communities. Radio, 28%. Email, 23%. And the internet, 19%. Providers also suggested other options. Senior provider survey question number 7. Senior service providers were asked what area they worked in. 41% responded nonprofits, 19% senior centers, home care, 17%, our very own neighborhood advisors, 8%, nutrition, 7%, counseling and advocacy, 7%, and elder abuse, 1%. Also represented were providers from legal services, government, senior facilities, and many other local agencies. Senior provider question number 8. What are the biggest concerns facing seniors in 2021? Providers were asked to select all that applied. Naturally, end to the pandemic, 78%. Isolation, 78%. Transportation, 54%. Home care services, 39%. Meals and shopping, 39%. Money issues, 32%. Housing, 25%. And home repairs at 16%. The input we received was extremely valuable as we fine-tuned our 2021 service plan. Many thanks to our seniors and our service providers for helping us with this project. The year ahead, April 1st, 2021 through March 31st, 2022. We will continue support of our mandated services and provide services to the community through contracted agencies by means of a competitive procurement process. Telephone and in person, when able, information and assistance services will be continued. Senior nutrition services will work with contract agencies and community groups to increase access to senior nutrition programs and other supportive services. The expanded in-home services for the elderly program, ISIP, will continue to provide in-home services to seniors in accordance with New York State Office for Aging regulations and include consumer-directed in-home options for care. Caregiver services programs will continue to provide information, assistance, and public education to caregivers. The program will also offer and facilitate caregiver discussion groups throughout Onondaga County. The HICAP, Health Insurance Information Counseling and Assistance Program, will continue to offer free and unbiased insurance information. New York Canucks will continue to offer a no wrong door program for free and impartial information and assistance on long-term care services and supports for people of any age and any payer source. Certified staff will provide options counseling to assist families in choosing appropriate person-centered services. Community services for the elderly programs will continue to operate with the goal of creating and implementing programs and services that meet the diversity of need for our older adults. Providing ethnic and culturally sensitive casework practices continues to be a central focus. Access to energy assistance for income-eligible seniors will continue through the HEAP program, as well as other programs. Continue community-based funding for transportation services and seek ways to coordinate and expand in underserved areas for seniors and individuals with disabilities. The Health Promotion Disease Prevention Program will focus on increasing access to evidence-based programs such as chronic disease self-management, Tai Chi for arthritis, and diabetes self-management in underserved areas. We will continue and expand our falls prevention program, and public information will continue to be distributed via a variety of venues, including social media, multimedia, printed outreach materials, and on our continuously updated website, www.ongov.net/aging. Our office is committed to the continual enhancement of the well-being of seniors in our community, and we can't do that without your feedback and assistance. On behalf of everyone in the Office for Aging, we thank you and invite you to contact us at any time.